did your last imaging show?
No cirrhosis anymore.
How do you feel about it?
I feel wonderful about it. I'm very excited.
Today, I have the pleasure of introducing my friend Joni. I've known Joni for almost at this point, probably 15, 16 years. And you guys are going to really resonate with the story because she actually started to get multiple diagnoses that started to add up. She had a history of Hashimoto's, she had chronic pain, and the pain just kept adding and stacking on. And then right before we reconnected, she had a diagnosis of cirrhosis, which she felt like was a terminal diagnosis. That was the message she was getting from her doctors. And that's when Joni, we had a previous relationship. I've known her for a long time. She reached out to me. I'm really excited to interview Joni today with Anne to show you guys where she is today and to also bust some myths around this whole concept that there's stuff that's incurable. Here we go.
Hi, everyone. I'm Joni Knight. I live in Oregon with my husband. I have 3 grown children, 9 grandchildren, and I'm a realtor.
Joni, thanks for being here. And I know you have a long history with Dr. Maggie, actually. You were a patient of hers, being in close proximity to her for how many years?
I've known her for probably 15 years now. As long as she was a physician in Sherwood, I was one of her clients.
Lucky you, while she was in private practice there, able to have her as your own personal doctor. But then I want to hear what's been happening with you over the last several years.
Probably 2 years ago, I was starting to have a lot of extreme pain, stomach pain, just not feeling well. So I finally got extremely sick, went into emergency room and started having a lot of tests done. They surprisingly diagnosed me with acute pancreatitis. I had lots of tumors in my spleen, cysts in my pancreas, and then the cirrhosis in the liver, which alarmed me tremendously.
What was that like to get that diagnosis? And then I want to hear about what life was like after that and trying to manage it and deal with it.
Well, it was very stressful because I did know they were definitely serious problems. I'd never been a drinker, so I didn't see how I could possibly have cirrhosis.
Mhm.
Didn't make sense to me because I knew Maggie well enough to give her a call. I just said, "Hey, do you have somewhere for me to go? What do I need to be doing? Can your program help me?" That sort of thing.
Okay, so you went directly to Maggie as soon as you got these diagnoses, and so you jumped in on the program right away, it sounds like.
I did, yeah, probably within a couple months of having these diagnoses, I started the program.
You didn't have any reservations about joining. I mean, you already knew Dr. Maggie and trusted Dr. Maggie.
Hi, I'm Meg UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform Protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
You had that experience, you had the long-standing relationship, and it sounds like you were quite confident that she was the answer.
Yes, I did have the confidence in her. She'd always helped me as my MD. She had first diagnosed me as gluten intolerant. I'd had a lot of pain issues throughout my life. And once we eliminated the gluten, it was amazing how much I improved.
Mm.
And so throughout having her as my MD, we just tackled several problems that seemed to get better continually.
Sometimes people will also say that the program cost gave them pause for a moment. Was that the case for you at all?
I think had I not had serious health issues, it might have. But because of the severity and the importance of getting well, no, I didn't have any cost reservations.
You were really in a dire situation. So I can understand why you wanted to get right in. You mentioned extreme pain. It sounds like on a scale of 1 to 10, you would rank it
It was always 7 to 10.
7 to 10. Okay, extreme
Yeah.
pain. Where
So,
does your pain level stand now?
for the most part, it's usually down at a 3.
A 3.
Yeah, it's so much better. There are days that I don't have pain.
No pain at all. The food, that was a big one for you. What else do you think helped diminish your pain so greatly?
I truly think it was balancing blood sugars, having much better digestion, eating properly, getting good nutrients into my body, honestly, just it's made a lot of difference. I wasn't eating enough of the proper nutrients. And
Mm.
so as I've increased that, I just notice I feel much better. My thyroid seems to be actually in a much better range, which has made a huge difference.
Right, because you mentioned you had always been hypothyroid, but I know you told me before that you also were diagnosed with Hashimoto's, and now you're working to really optimize your thyroid level. You can feel the difference.
Yes, I can feel the difference. I definitely don't have near as much brain fog. I'm not as tired during the day. So feeling much better.
And what is that like for you?
I think overall my health has really improved a lot. Truthfully, I feel so much better. And sometimes as you get day to day, you kind of forget that. But one of the gals that works for me just says, frequently, she goes, I can't believe how much better you're feeling.
Well, now, isn't that amazing? I'm curious, your coworkers are even noticing this. How has this impacted your family and those close friends and people around you?
I think everyone can definitely tell the difference. It's just made me feel better overall and easier to participate in things.
What's something you're able to do at home now relatively effortlessly that when you were so sick before joining the program would have been impossible?
Well, when I was extremely sick, I just didn't feel like I could do anything almost. I've always been a workaholic, and it was getting to the point where it's almost hard to even answer a phone and just deal with work at all. And then as I've gotten better, I'm back to full force at work and, doing whatever I need to do for our family.
So big, big turnaround in your life. How long
Yeah.
ago did you graduate the fundamentals program?
I graduated, approximately a year and a half ago.
Okay, so you've been able to really maintain a wonderful quality of life for a long time now.
Yes, I have. I have.
And whatever happened to pancreatitis?
I have not had an attack since the one when I diagnosed 2 years ago, so I'm feeling, very good about it. I'm not having the pain from the pancreatitis, and it has not advanced any.
Okay, so pancreas issues sounds like resolved.
Yes.
But Joni, you learned some very interesting information about your hormones from Dr. Maggie. What did you learn?
I learned that I had PCOS, which was causing a lot of problems. I started taking several of her supplements to improve on my hormone balances.
So to find out you had PCOS, was that surprising to you, polycystic ovarian syndrome?
Yes, it was. Honestly, I didn't even know what it was. It definitely has helped as I've taken the supplements. I'm starting to see the levels of my different hormones improve. And as far as like getting much more restful sleep, it's definitely been an improvement just knowing that I had it and how to help correct it.
What changed in the way you felt? Is it related to potentially your hormones?
I would say that was probably part of my brain fog, my sleep pattern. They started improving for sure.
Ah, so tell me what was happening with your sleep.
I've always had extremely poor sleep patterns and wake up many times a night, just cannot sleep very much. So once we started adjusting, taking the supplements, which has helped adjust my hormone levels.
Yeah, to
And
support them. So you're in balance because now you're in balance. And guess what? If you're sleeping, then you're able to help produce the proper hormones as well. Because when you're not sleeping, your hormones are going to really have a tough time coming in line, right? uh, we have a special guest who actually was able to just join us. Maggie, do you want me to pop you in at all?
Hey,
hey there.
how you doing?
We were talking about how cirrhosis is something specifically that doctors will tell you, okay, this is permanent. This is damage to your liver that's never going to get better. We can maybe stop it from getting worse, but that's as far as we could possibly go. But for you, go ahead, Dr. Maggie.
Can I interrupt that?
Please.
Because when I hear that, I say bullshit. In fact, I say bullshit. And the thing is, because I do think that even the term like cirrhosis, the cirrhosis implies that it's a permanent scarring of your liver. So you think permanent death. But the thing is that when even if you get labeled cirrhosis, yes, there are definitely parts of your liver that is cirrhosed and dead and scarred, right? But there's so many parts of our liver, so many parts of our body that isn't permanently damaged or even able to heal or that are normal that we can get to regenerate, heal, and fix itself. And the process isn't just, oh, you have this diagnosis, you're doomed. It's almost like, okay, we have isolated parts of your body that are suffering with that. But then what are the tools we have to actually help you recover any of those transition cells or any normal cells to keep them from dying so that we actually have an active, healthy liver? People do liver transplants, meaning like you can even take parts of a healthy liver and put it in someone and they could have cool, full liver capacity from that. So no, sure as hell not, it's not a death sentence. I go into like, okay, now what are the tools we have to actually fix all this? So but unfortunately, when we're looking at conventional medicine, I mean, a lot of people look at that and they're like, oh my God, cirrhosis, it's like a death diagnosis. And I'm like, oh no, because they don't have the tools.
Mm.
I love the fact, I mean, Joni, you and I spoke on the phone when you get that diagnosis and we talked about this. And I said, no way, there's so much we can do about it. I get excited when someone tells me, I have this incurable, totally difficult. I'm like, can I just share my hundreds of tools with you? So to me, it was actually excitement when I hear something like that, not like, oh my gosh, this is like some death sentence.
And you were very good to help me with that because I was very frightened. I felt like you could take charge and help me and to really help improve that to overcome the diagnosis. It felt good and reassuring talking to you. I felt like I had some options and ways to improve my health.
You did improve your health, Joni, because I know
Right.
now you're getting regular checkups, MRIs on your liver, and you went from having this diagnosis of cirrhosis, permanent damage to your liver, to what did your last imaging show?
Oh yeah.
Yeah, it's now no longer cirrhosis. They've said that it shifted to fatty liver,
How did
um,
that happen?
but no cirrhosis anymore.
Your doctors didn't think this was possible because they don't see that every day. Now you no longer, you've been downgraded to fatty liver, which is something that in the program Dr. Maggie focuses on extensively with people anyway, is how to
Yeah.
support somebody with fatty liver. So even that you can probably expect improvements in.
Yes, and I do anticipate improvement as I go along. I continue the good eating habits, the supplements, and from my estimation, each year when I get another MRI, I'm just hopeful to see more and more improvement.
And you can
I'm
feel
not
the difference too, because that was some of your pain, right? Was, I'm sure, the extreme pain coming from that.
Yes, the definitely I had a lot of liver pain,
she had
and
liver pain.
yeah, and that has improved tremendously. I don't have liver pain anymore.
How do you feel about it?
I feel wonderful about it. I'm very excited. It's just been very reassuring to know that I no longer have cirrhosis.
She suffered from lifelong constipation. And within 3 to 4 weeks of going through your program, that was gone.
Not having constipation all the time has been wonderful because you just always never feel your best. You just always have this heavy, crummy feeling in your stomach. And so to know that I don't have that and know that it's gone feels wonderful.
Can I
It's
tell you guys one tip though? You guys have heard me say it in the program over and over again. So if you don't poop every day, you cannot break down hormones and achieve hormone balance, and you cannot detoxify your body.
Mhm.
And so for me, what I think about is let's say I used to poop once every 3 days, and now it's every day. And every day that you eliminate, you're eliminating these hormone breakdown products and toxins, right? But if you go from every 3 days to every single day, you've decreased your circulating hormones and your toxin load threefold.
Yes.
And I feel clean. I feel lighter. I feel less toxic. I feel less swollen. I feel more energetic. My mood is better. My sleep is better, right?
To all those things, that's so true.
It's true. I don't think people realize, and I actually say if you don't poop every day, you can't balance your hormones. But I think that's a totally understating the benefits of being able to poop every day. But I had a question for you. Why do you think you were able to poop every day? What specifically was the one thing you think you did that allowed you to poop every day?
Honestly, I think it was improving my diet. I was so confused until I came to the program on what to eat and what not to eat. So, with hypothyroidism, Hashimoto's, you start reading things and they're
Hmm.
don't eat this vegetable, don't eat that vegetable, and pretty soon you're like, I don't know what to eat anymore.
Yeah.
So I was just so confused on my food. I had a terrible diet, truthfully.
And you were trying to be healthy.
I was trying, but I wasn't doing a good job at it. And once
Well,
I came into the program, I think it was very clear and easy to follow.
so, Joni, in the end, when you went through the food mapping process, which gives people 100% clarity on exactly what foods to remove, but also what foods to reintroduce back, what were some of the things? I mean, how many things did you really have to remove
I
based
didn't
on data?
I
Based on
didn't have to remove anything. I had removed eggs and dairy, honestly, for years because I thought those were issues. But as we went through the program and as I started eating, taking Digestit, having my supplements, I could add those back in. And I've eaten eggs, almost daily since. It's so nice to have them back.
I'm sorry, but for an egg lover myself, if I had to remove eggs unnecessarily, that would piss me off. And I would say my first bite of eggs from that would probably be an orgasmic experience because I freaking love eggs. But that's the thing is like you're removing these major food groups. We're talking what? Eggs and did you say dairy as well?
Yes. Yes.
Unnecessarily
Yes.
and
And
not even getting better, getting worse.
right. I mean, honestly, even for thyroid issues, I mean, sometimes you read, the cruciferous vegetables that you're not supposed to eat. So that was always, it always confused me so much because I would think, why am I not supposed to eat any of these? And I kept
But
taking out more and more vegetables that I really should have been eating.
for your liver and for your hormones
Yeah, for both. And
and
so
for your thyroid.
that's been huge as far as to add those back into my
Well,
diet.
think about this, guys. This is the exact opposite of what you're Googling on the internet.
It is.
The opposite thing is actually the best thing for her thyroid, for her hormones, and for her cirrhosis.
Yeah.
Boom.
And I had removed most all of those.
Okay, I'm done with that removal shit.
Goodbye.
So she was able to actually add back a lot. That's the whole point. I love it. This is the whole point of food mapping as a process to get that 100% clarity. Not only do you have to not remove, most people not have to remove more, most people are reintroducing a ton and getting the results. That's the key.
Yes, it's been great.
Thank you, Joni.
All
Thanks,
right.
Joni.
Thank you.
Wow, Dr. Maggie, I'm blown away just hearing that cirrhosis is something that can be turned around because that's something you don't hear about. Doctors do not tell you, hey, this is something you can work on. All they tell you is this is permanent damage, but
Yep.
not in your world.
Not in my world. And the thing is, I think it really is an understanding that doctors don't have the training to have tools to turn around cirrhosis or fatty liver, to be honest. So Joni is a perfect example of somebody who did know about me. You
Mhm.
know, she did know me before, but now you do. Everybody that's watching, you know I exist, you know these solutions exist, and you know these results exist.
And there's something that you, Dr. Maggie, can do to help
There's a
anybody
lot.
who's watching because
There's so
you
much.
don't have to live with these diagnoses and you especially don't have to live with these symptoms. If you're in somebody that's in extreme pain or you're dealing with fatigue, you're dealing with brain fog, you're dealing with thyroid issues, any of the issues that Joni was dealing with, there is a solution out there and you don't have to feel so bad.
100%. And I've seen cases after cases after cases, and this isn't even our worst case. So I think she's a perfect example of what could happen to anyone when they're willing to reach out, when they're willing to learn, and they're willing to implement. And the solutions can be easier, 10 times easier than you think it is, too.
You're right, because she told me she was in such extreme pain on a level probably 7 to 10, and
Yeah.
now some days she has no pain at all. So if this is resonating with you, if you know somebody maybe that is dealing with these kinds of symptoms, there is help out there, and all you have to do is reach out to the Transform team and Dr. Maggie, and you can get started on your your path to feeling well as well.
There's a link above or below this video for you to start a chat with our team. You can join our Facebook community as well. There's a link above this video. And the last thing is, I think sharing is caring. And I love the fact that we have an audience that loves to raise awareness around this. I mean, how many people is suffering in silence like Joni that you know with any of these symptoms? Tag their name in the comment section because you know what? Sharing is caring, and I want you to help me raise awareness around this.
Thanks so much for watching.
Thanks, everybody. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire, and that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.